Dr. Jaffe, what is polysaccharide LPS and how does it fit in conjunction with food and chemical sensitivity tests?
Well, thanks for the question about what is abbreviated LPS. Now, polysaccharide means multiple sugars arranged in a specific way. And you were good enough to include a reference to an article. And I'd like to read the opening paragraph of that article because I think it explains part of the answer very well. And then I'll complete the answer. So what they say is, inflammation is a powerful, organized, and complex immunologic response to infection and tissue damage. Then they use an abbreviation, TLR, which means toll-like receptors. And they say these toll-like receptors sense microbial presence and host damage risk that are key to innate inflammatory responses. In specific, there's toll-like receptor 4, TLR4 is the most extensively studied. It recognizes lipopolysaccharide, an outer membrane cell wall component of gram-negative bacteria. Now, for any of you who don't know gram-negative from gram-positive bacteria, both of them are indications of pathogens. So these are complex saccharides released from the surface of bugs that shouldn't be in the intestines, but when they're in the intestines and the body is trying to get rid of them, some of their surface complex carbohydrate is released and profoundly activates the immune system. So this LPS, this lipopolysaccharide, upregulates immune defense and repair responses. It's non-specific, it's a non-immune but functional enhancer, a non-specific upregulator. And it depends upon enough ascorbate antioxidants, enough polyphenolics, enough carnitine fumarate, and enough triple detoxifier, the phase 1, phase 2, phase 3 PERC detoxin guard triple detoxifier. Then they go on to say, ligation of toll-like receptor 4 triggers intracellular signaling pathways, culminating in the production of pro-inflammatory cytokines, chemokines, and type 1 interferons. These are sourced from essential fats. If you have omega-3, they go down one pathway. If you have an excess of omega-6, they go another pathway. And then they say chronic or repeated exposure of macrophages to this lipopolysaccharide leads to a phenomenon called LPS tolerance, which represents a state of altered responsiveness to additional LPS challenge. It's also known as adaptation or tachyphylaxis, which means if you keep stimulating, the system says, oh, I know what you're doing. You're upregulating my immune defense and repair system. I'm going to stop listening to you because I don't want it on red alert all the time. The most notable feature of LPS tolerance, they say, is the downregulation of pro-inflammatory cytokine expression, including tumor necrosis factor, TNF-alpha, interleukin-6, I would guess interleukin-12 as well, in response to the LPS stimulation. LPS tolerance is critical in limiting the innate response to infection to reduce host damage and promote resolution of inflammation. In other words, complete the repair. Failure to enforce LPS tolerance can lead to profound consequences, including death as a result of excessive and uncontrolled cytokine levels. So kind of important. And what we want our colleague to understand is that these LPS lipopolysaccharides are derived from dysbiotic or pathogenic bugs in the gut. They are a non-specific stimulant or an upregulator of immune responses. They're not immune specific. They just generally upregulate the system in the short run. And if they stay in the longer run, then the body adapts and starts ignoring the stimulation signal so you don't end up with an immune system that's overstimulated and exhausted. So, important question, LPS, it is not immune, but it is an upregulator of immune responses. And it will do its job better, and the body will adapt more easily when you have enough of the PERK potency guard, the PERK polyphenolics, such as pain guard or repair guard, the PERK metabolipid carnitine fumarate in its special micellized soft gel, and the triple detoxifier, the PERK detoxin guard. So thanks for asking the question about lipopolysaccharide. It is known to upregulate immune responses in the short run, and if it continues to be present, the body begins to adapt and to ignore that upregulation signal so that the immune system doesn't get exhausted as well as overstimulated.